I want to go back to something you harped on a little bit before, is this idea that when you did some stem cell therapy, when I've seen people I've kind of, spoken to people who've done this, even Gabe Asprey is one of the people that did so much stem cell therapy and absolutely a proponent of it. But there are those 30 or so percent that say it did nothing. I spent a lot of money, it did it, and it did nothing. And then there are people out there that saying, well, stem cells by themselves sometimes do not know where to go. Sometimes they just enter the system, and without some triggering or some other cells, of course, telling them where to go, they may not go to the place they have to go. And one of those things are things like platelets. And I've heard that, first give a platelet therapy, PRP or something, then provide the stem cells, you may get more. What are your thoughts on that? Because it is, again, some confusion. Are stem cells the one going to the area, or other cells in the body kind of being the signal saying, come here, we need repair? What are your thoughts on that?
Okay, there's a lot of layers here in that question. Let me start by the later part of your question. When you use platelet, that is something that a lot of people are unaware of, even people who do platelet-rich fraction or platelet-rich plasma, is that when you do this, you obviously concentrate the platelets, but in that fraction, there is a type of stem cells that have received various names in the past, let's say 15 years of research. They've been called blastomere-like stem cells. Blastomere is the embryo. They have been called multipotent adult stem cells by other groups. They have been called very small embryonic-like stem cells by other groups. Right now, this name, V cells, is the one that has stuck the most in the literature and in the general population, general public. In practice, medical practice. So these cells are about the size of a platelet. So you find them in the platelet-rich plasma. So when you do a platelet-rich plasma, you do a stem cell injection. This is stem cell therapy. These cells, contrary to other stem cells, can be found in a quiescent state and an activated state. And there are ways that you can activate them. For example, the blue-green algae that we started with at the beginning of our talk, we were doing this work at the time when these cells started to be documented. So we also looked at these cells in the blood circulation. We continue to look at these, and we put more in the blood circulation, and we activate something like 30 to 40% of them. So when you do PRP or PRF, you do use you use stem cells. It's a kind of stem cell treatment. Now, going back to the first part of your question, and it is something that if you go to, let's say, more sophisticated stem cell clinics, they have started to do a lot of things to bring more people having a positive experience with the treatment. It's to realize that once you've put stem cells in the blood circulation, there's a lot more that you can do to help those stem cells do their job of repair. When you say sometimes they don't know where to go, they always know where to go. So it would be like saying an immune cell doesn't know where the infection is. The immune cells will always be attracted to the infection. But what is the ability of that stem cells to reach that specific area? And when it reaches that specific area, how untouched is that immune cells to be able to fully do its job? So it's the same concept with stem cells. So you put a stem cells in the circulation, it will be attracted to the places that need repair. If it was not, you would not be alive today. So they're attracted to where there's an injury. But if you get systemic inflammation in your body, which is a background of noise, the inflammation that you have systemically in your bloodstream is the same signal that the tissue that is in need of repair is releasing. It's been screaming for repair for so long that now that signal has seeped everywhere in your body. So now the stem cells, so the best way to summarize it is to say your signal to noise ratio is too low. The stem cells hears too much noise. Sometimes I make this analogy. It's a silly analogy, but I think it gets the message across. For stem cells to find where the injury is, it's like me taking an apple pie straight out of the oven. I'm in a hotel and I put it somewhere and I tell you, go find this. How do you find it? You walk everywhere and you follow the apple smell. Now, do the same thing while I put 1,000 crushed apple on the ground. Now it's much more difficult to find where the apple pie is. It's the same kind of thing. So if you reduce systemic inflammation, you will never reduce it enough to silence the area that has the injury, but you're going to reduce enough of the background noise. So now you've increased your signal to noise ratio. Now stem cells can see where to go. So that is the first thing, reduce systemic inflammation. But there's another thing that I'm talking, there's many things you can do here, but I'm focusing on the main ones. The other one is microcirculation. A stem cell can be up to 20 micron. Your capillary is 12 micron. The stem cell can only migrate in a tissue when it reaches that part of your capillary called the post-capillary venule. That's the area that has the machinery to allow stem cells and immune cells to migrate out of your plumbing to go into the tissue. So it needs to reach that area. So in order to reach that area, the stem cell must have a very flexible membrane, omega-3s, fish oil, all of these, algae oil, to be able to squeeze itself into the capillary. But to do that and flow properly, you need to have good blood fluidity. So you take nattokinase to digest fibrin to get good blood fluidity. Now, these capillaries must be able to distend themselves to allow that passage. So nitric oxide to dilate the microvasculature. And in order to really go slick into that capillary must have a healthy glycocalyx covering the endothelial layer. So fucoidan and different glucose aminoglycans, GAG.
Big words, yes.
There you go, GAG. These are ingredients that will allow to rebuild this glycocalyx. So all of this will basically help stem cells in their ability to reach the tissue that is calling for repair. And other things that you can do, aside from all of this. But sure, these are the two, to me, these are the two main ones. And for example, when a stem cell lands in a tissue, resveratrol will support proliferation of stem cells and their differentiation. One stem cell will multiply and become more than 5,000 tissue cells. It is probably something that is absolutely not talked about, but it is probably one of the greatest metabolic demand of the body. This amplification of stem cells into your tissues in the process of repair. That stem cell that has a few mitochondria will become 5,000 cells, all of them having a few mitochondria. It is an explosion of mitochondrial requirements, if you want. So you talked about NAD before. That's where you need to have a lot of your NAD in that process. So resveratrol, boosting NAD, reducing systemic inflammation, boosting microcirculation, all of these are essential to really get the maximum out of a stem cell treatment.
No, I'm glad you bring it up because a lot of people just think it's a one-to-one. It's a therapy and a result when there are synergies to be had and actions to be taken to make the most out of it and make it an effective type of therapeutic option.